So next we have Dr. Digvijay Singh, past President UOC and Director Noble Care in Gurugram. So he'll be talking to us on the power of AI, opportunities, strengths, and the way forward. Over to you, Dr. Digvijay.
Right. Thank you. And Nilesh for giving this topic and initiating some better discussion. So I'm going to look at it specifically from my subspecialties that I look at, which is pediatric ophthalmology and neuro-ophthalmology. And it's not moving forward. So it's okay. Okay. Yeah. There. So, these are two specialties where we are looking at AI, and AI is relatively more nascent in these specialties. We'll also come to why that is the case. And in pediatric ophthalmology, it is being used. The opportunities are to detect diseases early, to screen, to classify, risk stratify, look at therapeutic outcomes. And this is pretty much what it is done for all other specialties too. But here it is being done in certain specific sort of, I would say, diseases or conditions. So in early detection, AI, and I'm just showing you some representative papers that have come out. This is looking at detection of myopia, detection of strabismus, detection of ptosis based on external photographs. And this was done in the Oriental population. So this is one form of AI which has actually looked at that, and it's found a reasonably good accuracy and reliability, in fact, almost as compared to a human being. Of course, this is still, it's in a specific subset. It cannot be transferred right now to other populations, but this is one way of doing an early detection. Then there is a risk stratification where the AI is looking at fundus photographs of patients with myopia, so myopic fundus, and then deciding is this a high risk for potential problems related to high myopia later or not. And again, that's another form of AI that's come in. So risk stratification. So you can tell a parent that this child's retina, the AI will say, is something that he's at a risk of developing a retinal detachment or any other complication in the future. This is a paper that I've published. We were working on ROP screening. So this is a multiple instance learning AI where you can take pictures from the fundus on the fundus, and it can detect ROP. A lot of the ROP pictures are actually based only on the posterior pole, but this one looks at it beyond that as well. Again, this is an early ROP screening. There are very few people being able to do effective screening outside. So if there is a portable camera, and they have come out now, you can actually use these kind of tools to help screen ROP in babies, even where an ophthalmologist himself is not present. So, but as of now, these are still being published from a technical standpoint. There are a few of the ROP models like Deep ROP that you can see here, DLROP, MiGraph, that have come out and have shown reasonably good success as well. Then you come to cataract detection. I think this Karthikeyan has already also shown, but this is where the heat maps and other forms of AI are being used to detect cataract in children. Though in the pediatric population, they have not found it to be as accurate as what the human being was doing, but it has been able to reasonably, moderately, I would say at least, detect the cataracts. Patient satisfaction was very good because one quick photograph and the parents told that it's there or not there. So children, parents, patients, all of them are actually pretty satisfied with this software in their study. And then you've looked at this, which is looking at surgical outcomes. So this is again becomes an important part. If I'm operating a cataract in this child, what's the outcome going to be? What other complications, adverse effects can happen later? So that is looked at by this form of AI, which is called the CC Cruiser, and this is being able to predict based on the type of cataract, and it's based on association. So this is an association mapping based AI, again something that has come out and is available outside. So the strengths, in AI in children is that it's a well-defined cohort. We're looking at specific diseases in a specific age group. We're not looking at it across the border, but that also does become its weakness, and I'll discuss a little later in this same slide. The other side is that it's still a nascent field. It's open. Not all AI can be adapted here, which is already out in the market. So new development is happening based on already what we've learned from other diseases. And there's very high impact because anything that you do and you can correct at a young age, the overall impact is immense compared to doing something for somebody at an older age. But one has to remember that in children, it's a developing eye, so things change. The picture is not the same. It's we don't have very good data. It's difficult to acquire good data. Reference standards are not established completely, as well as the the very fact that there is a fair amount of heterogeneity over the growth itself makes it difficult to do AI in these fields, and the adult models are not being able to get adapted to children that easily. The retina looks different, the anterior segment looks different, and so therefore this does require further work on. But it is a field if anybody wants to look at. It's very nascent and a lot of it's open, wide open. Now let's look at neuro-ophthalmology. Neuro-ophthalmology, again, much like pediatric ophthalmology and other forms of AI, there's disease detection, there's classification of disease, there is risk stratification. There are some, in this case also localizing of the lesion comes in. So let's look at some of the papers that have come out. Detection of optic nerve, it changes. Of course, the first thing that people want to do is this optic nerve normal or abnormal? If abnormal, is it glaucomatous abnormal or a non-glaucomatous abnormal? And that's what this AI through this convoluted neural network does. And it has shown moderate to good accuracy overall. Further classification, and a lot of AI now has happened on papilledema. So this is one such paper that has come out by Akbar et al. So they are looking at papilledema and classifying papilledema, or putting it into its various grades, and they've again found very good accuracy. In fact, human level accuracy, if not better, compared to experts. And this is looking at whether a disc is having papilledema or not, and it's looking at certain textural features, the color, the vasculature, the obscuration of the disc margins. So a lot of that goes in the analysis, and it does come out with the AI. And this is one of, I think, probably about 8 or 10 papers which are working on papilledema per se, because presence or absence of disc edema is something that ophthalmologists of course want to know, but everybody, all other specialties also have a need to know. So this works very, very well. Visual dysfunction, this AI looked at being able to look at visual fields, and there's again one which is done on OCT, but I just put one visual dysfunction as a representative paper here. This is looking at being able to analyze whether a particular field defect could be related to a cellar or a pituitary lesion among field defects of glaucoma. So they took lots and lots of fields, and they took patients who were thought to have glaucoma, turned out to be pituitary tumors, and the other way around, and they found that if you do train the AI, it's able to pick up certain patterns, but unfortunately the false positive was higher, so a lot of neuroimaging ended up happening in these cases. So they still have to refine this, but again, it can look at visual dysfunctions or visual function dysfunctions, in fact. Going on. And then in ocular movement disorders, AIs have come about because again this is an external thing. You can do you can do an oculographies, you can do EOGs, you can do just videos, plain photographs using the smartphone to be able to detect squints, ocular movement disorders, nystagmus, and StrabNet is one such software that came out, and it's been able to detect vertical squints very well. Likewise, nystagmus has also been able to be detected with AI, and more so, even trying to localize which type of nystagmus. Is it central? Is it peripheral? Is it vestibular? That again, AI has been analyzed to look at that. Myasthenia gravis, based on facial features, ocular movements, presence of ptosis, variability, all that. There's another AI tool that's being developed to be able to detect that. So people at home can take pictures ultimately and know if there is a variability or a diurnal variation that they are actually facing based on the AI. The strengths of this is that in neuro-ophthalmology, there is a lot of pattern, whether it's the field defects, whether it's localizing the lesion. There are certain specific patterns. If this is the kind of field defect you have, this is where the lesion is going to be. If this is what the field looks like, most likely this is the cause for that. Likewise, if this is the movement disorder, this is where the problem is. So it does help because it's very well established. However, the data sets are small, and those are one of the weaknesses that come about. The other thing is that you can put things into buckets. Is it pale? Is it swollen? Is it normal? So that's the other aspect. So these are the strengths that based on this. But weaknesses are the heterogeneity of data, the fact that there are very few neuro-ophthalmologists, therefore not much work has happened on this field. It's come in about the last in the AI, the groups of AI that we look at, and the people of interest are less. At the same time, reference standards are not established, and a lot of it is being done by neurologists as well. So neurologists look at things differently, neuro-ophthalmologists look at things differently. So these kind of is what has been the challenges for AI in neuro-ophthalmology. Ultimately, what does the future hold? We do have lots of problem statements that need answering, particularly those on the side of treatment, that if this is the kind of optic neuritis, if this is the kind of vision loss, what is the outcome going to be? That's something a patient wants to know, and that's where AI will come in to tell, based on certain risk factors, based on certain factors, that the AI may pick up better than what an ophthalmologist can pick up. And that's, I think, also one of the places where black box is kind of AIs is working, and outcomes, and then therapeutic. So also to define that this is something you need to treat now, this is something we need to, we can wait, or this will not recover. So this is where the future actually holds in the field of neuro-ophthalmology. Thank you.
So, sir, one main thing, right now, even the new update from Zeiss in the HFA, it's very difficult to find the neurological settings. They mainly have prominently displayed glaucoma protocols are here. So that might be also one challenge, because most of the whenever like earlier also in our hospital, the technician were not knowing there is a neurological field, and whenever somebody referred to us for neurological field, we generally used to do a 24-2 and send it back.
Right.
So
So these, they actually, again, from two perspectives. One, that the relatively neuro-ophthalmological field defects are rarer compared to what glaucoma is. And these, all these devices were actually tuned and planned. Even the the protocols they use are all based on glaucoma only. Uh, the good thing, of course, is that neuro-ophthalmologic field defects are pretty absolute. So there could be hemianopias, quadrantinopias. So if you actually pick up that, it's easier to pick up. But the current fields aren't really designed to pick up neuro-ophthalmology. We kind of decipher it from there, but it's
so
not.
to train the AI based on those parameters
Is a challenge, and
is a
that's why
challenge.
you saw that differentiation between glaucoma and pituitary was very difficult, and they ended up doing so many imaging and realized that no, this was glaucoma in a different form.
So probably we will have to have a first to set a protocol for neuroimaging, perimetry, and then to go
Then to
train an
build it
AI.
up. Yes,
That will be
yes,
the way forward.
yes.
It would also be really good if you could train the AI, especially in our country where we do this mass school screenings, where they can easily pick up these refractive errors.
Yeah,
And
so I think AI based on the photo refractor. If you've seen that photo refractor, those small
Yeah.
photo refractor
Yes, yes.
cameras, right? So they give you refer, not refer, based on a certain. Well, it's kind of a very rudimentary form of AI in a way, but it can be enhanced to look at multiple things at the same time, whether it's strabismus or ptosis or cataracts or the difference in the Bruckner's reflex, difference in the red reflex, picking up refractive error. Very surprisingly, I mean, that paper which was looking at myopia is just looking at a photograph from in front and a photograph from temporally. But I guess in the Oriental population, they're, the kind of, if the eye is slightly prominent, they think it's myopic. So it picks it up. But in Indians, it will not work that way.